All right, since our timer is on, thank you, Purvi, for that kind introduction. And I'm going to just set the stage for how we are going to do this. For the purpose of this talk today, I am from the US, so I am the global perspective. And I'm going to call myself Santa or Santa, because I'm from the US. And then I bring to you the very dynamic Dr. Mahua Sikdar, who will be Banta. Just for you guys, Santa and Banta is a very popular pair in India that we see a lot of the memes. So we thought we would try to make this fun because it's Saturday evening, guys. We are just before the gala. And what we are going to do in the next 10 minutes is we are going to give you first, the idea is to act local. You want to know what's happening at ground level. This is Diabetes India. So Dr. Mahua from India will talk to you about her perspective about sulfonylureas in the current era. I will come in and just talk for 2 minutes about the global scenario and some of the guidelines. And then I'm going to ask our chairpersons, we are going to put you in the spot for their input and then take any audience questions. So over to you, Dr. Mahua.
Thank you, Dr. Rucha.
Sorry, Banta.
Thank you, Santa. So, we Indian, we have a huge diabetes burden in our country. Our mean HbA1c is around 8.9%, and almost 70% of our type 2 diabetic patients are uncontrolled. Again, it is tapped with over 30% of patients, they are taking 3 to 4 tablets per day, and that is why the poor adherence of the drug. So, along with the traditional complications of diabetes, diabetic kidney disease, retinopathy, then nephropathy, neuropathy, coronary heart disease, stroke, peripheral vascular disease, there are some emerging complications of diabetes like cancer, infections, liver disease, functional disability, cognitive disability, affective disorders. Majority of our type 2 diabetic patients, like around more than 67% of our type 2 diabetic patients are also having hypertension and hyperlipidemia. More than 62% of our patients also having overweight, obesity, and hyperlipidemia. We all know that endothelial dysfunction in diabetes is the cause for erectile dysfunction, and because of this erectile dysfunction, many of our patients are in emotional disturbances. And that is why good glycemic control still it matters. Good glycemic control is the foundational basis for the type 2 diabetes management. Despite the increasing focus on the newer therapies and other organ protective therapies, strict diabetes control is the foundational pillar. So in 2024 in Lancet, the third phase of UKPDS trial got published, which again reinforced the benefits of early and intensive control of type 2 diabetic patients for lowering the future complications. So here comes the role of sulfonylurea. Sulfonylurea has got the highest HbA1c reduction across till now in the world, around 1.5 to 2% among all other oral agents. It has got rapid onset of glycemic control. It can be combined synergistically with all of the anti-hyperglycemic agents. But in spite of the well-established benefit of sulfonylurea, its role in the therapy is actually inappropriately overshadowed by the newer and organ protective therapies. And that's why these consensus came from this part of the world. Cost of the medicine is still a very, very important considerations in Southeast Asia or South Asia, where actually majority of our patients are not under medical insurance. Because of high potency, low cost, and a very good usage of more than 20 years, these experience altogether have put sulfonylurea have got a position as the best OHA in especially in the
Wait, Banta, so you are telling us that we should use in the Indian scenario, you are using it because it's cheap?
Yeah, because cost is an important consideration in our part.
Okay, and it's also giving you good glucose control.
Yes.
But what about all the low blood sugar, and then why in the Western world we think no, even if you control it now, we know that, it's going to lose control, there'll be beta cell failure, and of course, if you don't reassess, the sugars are going to rise. Even the UKPDS, when it was reassessed, we all know that, correct? So Banta, please help us understand why still to use it in India, because
Yes,
globally we don't seem to follow all this.
the newer sulfonylurea group like glimepiride and glycoside MR, this group actually have got a very low hypoglycemic episodes. Okay, and also we can combine, these are actually, we can give once daily and durable in action, well tolerated, and that's why these are patient friendly also. So we are prescribing sulfonylurea like left and right. We cannot remove sulfonylurea in from our prescription. I would like to show you one really interesting data. In this study, withdrawal of sulfonylureas for patient with type 2 diabetes receiving long-term sulfonylurea and insulin combination therapy results in deterioration of glycemic control. Look at the data. Sulfonylurea deterioration worsened at least, see, within 8 weeks, just 8 weeks, the HbA1c has gone up to almost 1%. Insulin secretion has gone down to 36%.
So that tells you it was still working. Okay.
Yes.
All right.
So here sulfonylurea is starting from its launch of first sulfonylurea in worldwide in 1956. After that, the second generation sulfonylurea came in 1980s with better safety profile. And then UKPDS with sulfonylurea, they're advanced. Then Carolina, in 2019, Carolina came with, that shows that glimepiride has got a similar kind of a CV safety like linagliptin. Then thereafter, so many trials, low-dose glimepiride, metformin, they have higher adherence and glycemic durability. Then fixed-dose combinations of glimepiride, metformin, and SGLT2 inhibitors also coming. Now then, glimepiride approved in US in FDA in 1995. It is approved in India 1999. And the fixed-dose combination of glimepiride, metformin approved in India 2020-22. So sulfonylurea, this is a legacy of proven performance. Sulfonylurea-based combinations are, yes, they are still relevant and they are backed by Indian real-world data. Like you can see glimepiride is combined with metformin and voglibose. Then there is an original article with dapagliflozin, glimepiride and metformin. There is another paper on glimepiride, metformin. All of this data, all of these studies.
So Banta, let's stop for a second and tell Madam Chair, because she was very concerned when we are prescribing the patients in your, in the local community, multiple medications. We do have the luxury of these fixed dose combinations, and I would agree the data is small but emerging. So we are happy to show you that, and I'll let her finish. So yes, go ahead.
So all this real world data from India actually showed that it delivers a greater HbA1c reduction across monotherapy, dual and triple regimen. So that's why William textbook of endocrinology says that low dose glimepiride, around 0.5 to 1 milligram of glimepiride, they are the preferred sulfonylurea of the modern era. And once daily, can be given, they are weight neutral, and their cost effectivity, well tolerability is very good, actually appreciated in this part of the world. There are multiple, it is actually sulfonylurea widely used, very synergistically can be combined with different varieties of oral hypoglycemic agents along with metformin. They can be combined with DPP-4 inhibitor, SGLT2 inhibitor, pioglitazone, AGIs, even with insulin. So let us see some clinical, recent clinical evidence. This is a paper by Dr. Unikrishnan, in which the multiple strength glimepiride and metformin fixed dose combinations were used. They found that these combinations are beneficial in type 2 diabetes, irrespective of the age, duration of diabetes, associated comorbidities, irrespective of different BMIs. Then again, once a fixed dose combination of, this is a retrospective study of fixed dose combination of glimepiride, metformin and voglibose in Indian clinical practice, especially in the newly diagnosed type 2 diabetes, which also shows the real world utility. It is convenient and effective. It can give effective glycemic control. Then again comes fixed dose combination of pioglitazone, glimepiride and metformin, which also gives a rapid, very efficient and very effective blood sugar control with well tolerated in the patients in the study with the advantage of the lipid benefits. Then another study is fixed dose combination of DAPA, glimepiride and metformin. Here also we can find that similar group of result, like sitagliptin also has got metformin, with sitagliptin, metformin and glimepiride. There are multiple studies with sitagliptin, glimepiride and metformin, and all of these studies actually showed a similar kind of a result. Now, there are some patient matching profiles with their preferred combination. Now, most newly diagnosed diabetes, we can prefer sulfonylurea and metformin. Patient at high cardiovascular risk and obese patient, we can think of sulfonylurea, metformin and dapagliflozin. Young patients with high HbA1c, we can prefer sulfonylurea, metformin and sitagliptin. And patients with high ppg, obviously, we can give sulfonylurea and voglivose. Now let's come to some myths and versus facts with the sulfonylurea. The first myth, sulfonylureas are outdated. But the real fact is modern sulfonylureas are safe and relevant. Sulfonylurea have high hypoglycemic risk, but the fact is not with the low dose and smart combos. Okay? Third myth is sulfonylureas are not used with new drugs. But we have used in India, used with DAPA, CETA, even with insulin. And the last myth of the day is it is not guideline supported. But in fact, we still widely endorsed in our own Indian guidelines. So, sulfonylurea-based combination remain clinically valid, economically sustainable, patient-friendly. Let's use them wisely and combine them smartly.
Wow. Audience, what do you